Hello, it's Christina and Wayne again. Welcome to Coming Out with Cannabis. And I'm your host, Wayne Kelly. This is Christina D'Arcangelo Pooler, CDP.
I got my spring training gear on today because I'm a Yankees supporter, even though I live in Pennsylvania.
I know that. I know that very well. Thank you. Oh, before we get started, Alexa, give me a reminder in 15 minutes and tell me to shut up. So we'll see if she does that.
Okay, I'll remind you in 15 minutes.
Great. All right. Keep us on par here or on track instead of 30, 40 minutes of, chatting.
That sounds like a good plan, Wayne.
Good. Yeah, I think our followers will appreciate that as well. So I think today we're just going to talk a little bit about one of my favorite topics, data, and potentially collecting patient satisfaction information, in the medical cannabis industry.
Yeah, that sounds like a great topic because it's something that we come across all the time, right? As we're talking to patients, whether it be, through APA or something that we're participating in where we're interfacing with patients, and even just dispensaries, what kind of information do they have as far as satisfaction information from their patients? By the way, before we continue, today is Rare Disease Day. So happy Rare Disease Day to all of our patients out there.
That's right. And let's be sure that everybody is aware of Rare Disease Day. Rare Disease Day. That's a tongue twister. It can be. And oops, I'm not wearing my stripes. I was going to wear stripes today. So I'll have to change. To that's part of the Rare Disease Day awareness opportunity.
I just looked down at my shirt. I'm like, I think I have it. I do. I have this New York Yankees training shirt on that has this, because the Yankees have.
Oh yeah, that's true. They do.
See that?
Very good. Very good. So yeah, we just want to make sure that folks are aware of these diseases that are, for the most part, they're invisible. Folks suffer from these diseases on a daily basis, and it really goes unnoticed. And the rest of the community and folks around these individuals or patients have no idea that they're suffering. So we just want to take a moment to let everybody know that is suffering from these diseases that we support you.
Absolutely.
And, we want to make sure that folks that are not aware are aware. So we applaud you in your effort towards great health and wellness.
And keep your head up. Don't give up. There's a lot of things that are emerging right now in the rare disease space from a clinical trial standpoint, and not to mention, since this is a podcast about or a video cast, our YouTube channel, whatever you want to call it, is coming out with cannabis. So clearly one of our focuses is on medical cannabis and CBD as it relates to unmet medical needs. And in my opinion, and I think we share this opinion, rare diseases are unmet medical needs, right? So
absolutely.
Patients having the opportunity to be able to take, say, medical cannabis, perhaps to help them with their rare disease, even though it's not listed as a qualifying condition if they're in a state like Pennsylvania, say, for example. A lot of times these patients suffer from other ailments that allow them to be a qualifying candidate, if you will, for medical cannabis to take for their rare disease.
And if you're just joining us, we're talking about Rare Disease Day, which is today. You can find more information about that on raredisease.org. I just brought up the webpage while we were talking. And you're right. There are options and advancement in medicine, and where we're in CBD medicine, cannabis medicine. There are advancements in cannabis medicine that will help in many of these rare diseases. So, chin up. Things are happening, and we celebrate you today.
That's right.
Okay. With that, we did want to talk a little bit about patient experience, patient satisfaction. As we discussed last episode, we're both medical cannabis patients. And in my previous career or current career, I collect patient satisfaction data in traditional healthcare. And we believe, we were having this conversation earlier, that we are missing opportunity here in medical cannabis to collect that same data or similar data that is collected in traditional, that can provide valuable information to the dispensary, to your doctor, to the patient. So we were just discussing that a little bit. Christina, do you have any input?
Yeah, absolutely. Of course, I always like to talk about these kinds of topics. What
Oh,
topic
yeah.
is there that I don't like to talk about, really? Um, as it relates to patient care, right?
Hmm.
Um, but yet I believe that a lot of what we're doing, like we discussed in our first video cast from the traditional side, is really coming to be very helpful and handy in the medical cannabis and CBD space. And this is a great topic. I mean,
Yeah,
Pennsylvania just celebrated the opening 1 year anniversary
that's
for
right.
Fresco. Cresco just celebrated, and some of the other dispensaries that popped up thereafter are starting to celebrate as well. And this is huge, for us in Pennsylvania. And, as you know, the lieutenant governor is going around now meeting about recreational cannabis, and we're not going to get into that today.
No,
Um,
not today.
but you can tell that Pennsylvania is one of those states, luckily, that is on the forefront as it relates
Hmm.
to medical cannabis. And one of the things that I feel like needs to be done better is to evaluate patient satisfaction. What are the patients happy about with
Right.
respect to this program and their dispensaries and their medical cannabis physicians? They interact more so now with their
Mm-hmm.
MMJ physician versus their GP, say their general
Yeah,
practitioner or their oncologist or
that's
whatever.
true.
So how are they faring with being
Hmm.
taken care of by their physician? A lot of these physicians came from traditional medicine,
Yeah.
luckily, and have a fantastic CV and way of being able to treat patients. But there's a lot of things that are unknown for patients. So
Hmm.
what do they think when they go to see their physicians and the nurses that support the physicians in these private centers? Because
Right.
we're not at the academic side yet, meaning, you can't go to Penn, right? I'm a Penn patient for traditional, right? So my GP is with Penn and my specialist. Well, I can't go to Penn, even though Penn is part of the Chapter 20 research, right? In
Hmm.
MMJ. I can't talk to them about it. I can,
Right.
I do, me, I'm not shy. Plus, when I go, if there's a potential interaction with my CBD or cannabis I'm taking, like for example, I was on prednisone, right? Last week, as you know, I had this stupid virus.
Hmm.
Well, I had to go to the doctors. I couldn't, I had to get a prescription for prednisone. I wasn't going to get around it. And I had to tell them again, I reminded them again, I'm an MMJ patient, I'm a card holder, I take, THC products at nighttime. And then during the day, I take CBD. And
Right.
so they just, again, they record it, but they never engage me in a discussion about it. Right.
Of course.
So I would like to talk to them about it more,
Mhm.
because I feel like they need to be educated as well,
That's true.
because this is the way of the future.
Mhm. Well, that's a good point. In fact, if we talk about patient satisfaction or patient experience, and collecting that information, that's my heart and my
Right.
focus. That's where I come from,
Right.
is that data side. You know, we need to talk about or consider the education with nurses or dispensary staff or the bud tender. I guess that's the term used, but
Mhm.
we would in doing so, and in fact, Christine and I had conversation already this morning, and we are going to begin developing this type of questionnaire and introduce it to the medical cannabis community. We are likely to follow the format of the CAP survey, which is something that is mandated for all short stay hospitals in um, traditional healthcare, and we believe that it's going to help collect the information that is going to be valuable to the patient, the dispensary, the doctor, and the caretaker. So for me, we are about a year behind in collecting this information here in Pennsylvania.
Mhm.
And the HCAP survey creates a national benchmark across all acute care hospitals. And this is my motivation for medical cannabis, creating that standard of data collection, not data collection specifically, but creating that data collection standard that helps create that standard of quality that is
Right.
expected in
A
each
threshold.
location. Exactly.
We're
So that
right.
benchmark, that comparison benchmark is where you should be. You should exceed that on all measurements or I'm sorry, on all performance measures, but you should at least achieve the threshold.
I agree completely. And I think that having this type of questionnaire, which fortunately our Cannabot can deploy, thank God. So that way it's data that's being captured, unbiased. It's coming right from the patient's mouth. You can't argue with the results if it's coming directly from the patient's mouth, right?
That's
It's not
right.
hearsay. It's not somebody recording it from the dispensary or the cannabis physician, nurse, or whomever. This is completely unbiased data that we would capture.
Real
And
time.
we'll be able to do a trend analysis across all of Pennsylvania, say.
Oh, yes.
Pick this. And see, certain areas geographically that could be pain points. So in other words, are some of these patients not getting enough education about medical cannabis based on their responses? Is it a training issue with certain individuals
Staff.
within a dispensary
Exactly.
in a certain geographic area? And we're not trying to call people out, like we certainly wouldn't, but I want to publish a white paper about this because this is very important, and we need to validate what really truly is happening in Pennsylvania. And the Cannabot is the best way, it's the best way to do it because people can engage with our Cannabot, which, most of the patients that have already love it. Why not use our Cannabot and pick this information up and carry it forward and help our community and our fellow patients as we are these patients? I have things that I need to say about some of the experiences, just as just as I'm sure you do.
Sure.
You're,
both good and bad.
Right.
Both good and bad.
Right.
And in between, sure.
Right. And like even, I want to know about product availability as well. Like I'd like to ask that question, which is not something that would be in the CAPS survey. So I want to kind of morph it.
Absolutely.
That would be our starting point. And then all the experience that we've had thus far in cannabis, running clinical studies and then advocating, right? Let's take all of that and make it very simple. We don't want it too long because patients will lose interest and then not want to do it. And we know that's an important piece is compliance.
Well, in my history of collecting that information, I've been involved with a CAP survey since 2005, since inception. And that is one of the very important things. And I believe one of the reasons that the response rate isn't as great as it could be because that survey is so long. Patients get this paper survey in the mail and they just don't want to fill it out. It goes in the can. And that actually brings me back to something I mentioned last week. Here in the medical cannabis space, cannabis medicine, we have the opportunity to start doing things right, the right way, collecting data in real time, getting the voice of the patient as they're experiencing this, their response or their feeling of positivity or negativity. We're going to get that information, and that's going to create value for all the users. All the dispensaries and the doctors and care providers. They're going to know, like you said, it might be a regional concern, it might be a demographic concern. It might be age, it might be race, communication. Might be a problem in areas that serve a certain ethnicity. So there are going to be things that we're going to be able to determine by creating a very specific questionnaire for medical cannabis patients, not just in Pennsylvania but nationally. And that's where the value really comes into play, when we create that benchmark and Pennsylvania can say, okay, we're doing this right, this state is doing this wrong. But not only state by state, but dispensaries within those states. And we have colleagues that have dispensaries in multiple states. Using a survey or a questionnaire like this, they would be able to determine how is my staff communication at this location compared to this location, and can we cross train? So it's very exciting stuff.
Yeah, I think that, kicking it off in Pennsylvania, since that's where we are now,
Oh yeah.
we're in Pennsylvania most of our time. I think, and especially since Pennsylvania has been so progressive, not to knock the rest of the states, the rest of 33 that have the approved medical cannabis or, recreational for the 11.
Hmm.
Um, I think it's important that we kick it off here and then move, into the other states thereafter.
Oh yeah.
Um, you know, I'd
Oh,
I'd like to hear what California, the West Coast is doing, right? Because they've always been so progressive and obviously ahead of us.
This is a
Cannabis was
reminder.
approved
Shut up,
in
so.
1996 in California, right? So,
mhm.
what have they done? There's a lot that we can learn,
This is a
across
reminder.
the country from many of our states that have already been in the space for way longer than, say, Pennsylvania.
Oh, absolutely. No, I think it's going to be very fun. Really getting down to the nitty gritty as far as data is concerned, but having fun doing it. And I think we
Right.
can. And like you said, by keeping it in Pennsylvania, and Alexa just reminded me that, I need to shut up. Let me
Yeah.
turn her off here before she badgers me again.
Sorry, I don't
Oops.
know that one.
Okay, there we go. But no, it should be very exciting. And we have access to a couple thousand patients in Pennsylvania. So it should be interesting to see if we can. Um, I would like to see, 100 volunteers take the survey so that we do have something we can sink our teeth into.
I mean, I think I read a couple days ago, it's 80,000 patients are registered in the state of
Oh, my
Pennsylvania
goodness.
for cannabis. I think that's what I read last.
Wow.
Um,
I
I
think,
pay attention to those crazy metrics because I want to know, I'm always worried about patient enrollment for studies.
mhm.
So that's, that's one of
Well,
the things.
and I just think, okay, so we had 80,000 patients enroll this past year and begin using medical cannabis, and we don't have any patient experience data.
None.
To the best of my knowledge, there has been no attempt to create nor collect this very valuable information. And I think we can pioneer this as well
Yeah.
if we have that opportunity. Oh, and before, since Alexa did tell us to stop,
Nip
uh,
it.
before we do, we want to make sure that, if you are watching, our channel or this video, we are very interested in talking to you about clinical research, about the potential for collecting this type of information at your dispensary, or just getting involved in helping us create this questionnaire, this very valuable survey. And again, we're going to follow the format of the existing CAP survey that is in traditional medicine, because eventually when CMS comes knocking, we're going to be ready for them because we'll have the same data they're looking for.
Mm-hmm.
And so get a hold of us, and I'll let you close us out. But again, wherever the like button is, or follow, share, I'm not sure which side I'll be on, but do it. Follow us, and let's get this party started.
Let's get
Christina,
cracking. Yeah.
that's right.
This is we honestly, Wayne, you're right. We want to hear from people, patients, people who work in the space, the cannabis space. We want to hear from you. What better, than to hear from people directly? So if you want to potentially be on our show, or you want to send us some information and have a chat with us, please feel free to contact us. And
That's
thanks
right.
again for tuning in to coming out with cannabis.
Yes,
And
always fun.
we hope you enjoy this session just as much as you did last one. This
Hmm.
time's a little shorter, so hopefully we keep you guys engaged. Thank you.
That's right.
Have a
Thank
great
you
day.
very much. Have a green day. Take care.